Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week, we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now, here is the founder of LTI and your host, Dr. Jason Roundtree.
Hello, and welcome back to the Laser Therapy Institute weekly podcast. My name is Dr. Jason Roundtree, and I'm your host again today. I apologize for being a couple of days late with this particular episode. I did end up spending some additional time in clinic this week early and just was not able to put this together to the quality I wanted it to. But, I do this just like you do. I get plenty of days in clinic seeing patients. We get to utilize laser therapy every day. I'm very grateful for that. And I didn't plan out my time quite as well as I should have. So we do shoot for Mondays, but hey, a little later than that's still getting it out there. So today I want to talk to you about laser and cancer. Because if you've looked into laser therapy before, you know that laser therapy is said to help with pain and inflammation because it helps to reduce inflammation. It helps to bring more blood flow to a damaged area. It helps to speed up the metabolism of cells and produce better energy production from the mitochondria of the cells. Well, as we're talking about that may sound a lot like cancer, right? Cancerous cells grow quickly. They need more blood flow, so they'll actually build vessels into the tumor site. They produce lots and lots of energy because they use it up to replicate and divide in an uncontrolled fashion. So if you take those two mechanisms kind of side by side like that with cancer and laser therapy and just theoretically compare them, you might say, maybe we shouldn't be utilizing laser on a cancer tumor. And maybe you take that a step farther and go, what if we use laser on a tumor before we even know that it's a cancer? What happens? As a matter of fact, we even have a few studies that have been shown to stimulate the growth of cancer cells in culture and even increase the aggressiveness of certain types of cancer cells. So right there, that should be a lot of, well, maybe we shouldn't be doing laser on cancer. And that is what this particular review that we're going to go over today talks about. This review is from the 2018 publication of Photomedicine and Laser Surgery. The title is Photobiomodulation and Cancer, What is the Truth? And the authors dive right into this whole idea of, okay, if we've got these mechanisms on how laser works by stimulating more growth and cancer works by uncontrolled, unchecked growth in the cells, is this a problem? What does the evidence really say? And further than that, too, what if the patient has an undiagnosed lesion that then becomes something that is lasered or that light therapy is applied to? Is it going to potentially worsen that undiagnosed cancer? So the author said right off the bat, if you're talking about cell cultures, that's not really applicable because pulling cells out of a tumor, putting them in a dish and putting light on them, you don't have any of the other factors that go on within a body, right? In vivo. So what they did is they rounded up the only 3 studies that showed tumor growth or tumor cell aggressiveness increases and went through them. 3 animal studies that have been done that did show one of them showed some increased tumor size as well as some reduced tumor size depending on dose. They also saw one that ended up with more poorly differentiated cells, and presumably that's going to lead to a worse diagnosis, a worse prognosis. But they said here's some problems with those: is that one of these studies that used very severely high doses of light, very very high, more than you'd use on somebody's lumbar spine to try and work on an orthopedic condition there. And this was on mouse tumors. Another problem with one of the other studies was that they used immunodeficient mice that were programmed genetically to not have an immune system. And so that doesn't really apply to the realities on the ground, as we'd say. And in all of these studies, they used only visible red laser. So yes, some evidence that you could make tumors worse with certain types of light, but some definite weaknesses in those studies. So then they went into the much larger body of evidence that shows good effects on cancerous tumors when you're utilizing laser therapy directly on them. They said there are 3 different effects really that they can find in the research. Number 1 is the direct effect. Number 2 is the combination therapy effect. And then number 3 is the immune system stimulation or regulation effect. So let me tell you a little bit about those 3, again, from this article here. So in the direct effect, the researchers overdosed the tumor by using a very, very, very high dose, long time application over the tumors. The second effect is that combination therapy effect, where you're taking advantage, they say, taking advantage of a differential effect of light therapy between malignant cancer cells compared to the effects seen on healthy normal cells. Combine that with chemotherapy, and you can actually improve the response of cells to those chemotherapy medications. And they say that's related to the Warburg effect. And the Warburg effect is where the mitochondria of cancer cells actually change their metabolism to carry out aerobic glycolysis instead of oxidative phosphorylation. And that happens because you have this rapid growth that goes on, which really outpaces the development of a good blood supply. So those tumor cells need to operate without the right level of oxygen. So they say, look, in cancer cells where the ATP supply is quite limited, the ATP boost that's generated by applying red and infrared light on the tumor may actually allow the cancer cells to respond to the pro-apoptotic cytotoxic stimuli from having those chemotherapy medications in the system, which are very heavily energy dependent. In other words, the response of these cells to the signals they're getting from the drugs require a large amount of ATP. And if the cell doesn't have that large amount of ATP on hand, then they don't respond to those kind of cell death signals that they should. They say, in contrast, normal healthy cells with enough ATP that you apply red and infrared light to, it actually produces a burst of reactive oxygen species that actually induce protective mechanisms and reduce damaging effects of cancer therapy on healthy tissues. So not only are you able to increase the response of those cancerous cells to the medication, the cytotoxic signaling, but even you're able to protect the healthy cells from that therapy, from that chemotherapy type situation. And they say, now look, this is a hypothesis, but we've got several articles that definitely say this could be the case. The third effect that you can stimulate with laser on and around cancerous cells is that immune stimulation and regulation. One of the problems with tumors is that they lose a lot of that typical immune system response there. So researchers said that stimulating the immune system correctly actually helps the body fight off the cancer. Specifically, you get increased recruitment of T lymphocytes and dendritic cells that secrete type 1 interferons, also reducing the number of highly angiogenic macrophages within that tumor mass, and even promoting vessel normalization. So, like I said before, one of the problems with tumors is that they construct these huge networks of blood vessels to feed themselves. If you can normalize blood flow to the tumor, then you can slow down the progression of that growth and deliver better immune system support to that area for the body to fight this thing off. They also noted that some studies have said that you can produce cytotoxic effects, so cell toxicity effects that are toxic to the cancer cells themselves, by generating reactive oxygen species causing acute inflammation. Now, inflammation, we always think of inflammation being bad, but inflammation is the very first step in getting tissues normalized and recovering so that they can heal. It's a very important process that just doesn't happen within a cancer tumor. So to go back to kind of our initial concerns, does laser make cancer worse? These researchers say, really, the more intriguing question is not merely whether laser therapy is safe and effective in cancer patients, but whether laser can actually play an active role in cancer treatment to help. So, should we even be asking about what if I have an undiagnosed cancerous lesion? What if I have a problem? Is laser going to make it worse? If your patients ask that, look, we don't have settled science on this yet. But the way that it's looking, laser therapy doesn't necessarily make tumors grow faster. As a matter of fact, the opposite could be true. So the conclusion? These researchers say, now is perhaps the time to lose the fear of exacerbating cancer by shining light on it. That doesn't necessarily mean that you need to start lasering every tumor you come across, or that you should guarantee patients any kind of result with a cancerous condition. This is simply a fresh look at, can laser cause cancer? And we really at this point have to say it doesn't appear to be that way. Based on the research, you might even see beneficial results in cancerous tumors. So if you have a patient that's like, oh, what if I have an undiagnosed, what if I've got a skin spot, or I've got something wrong with the bone? You have to do your job as a physician to get the proper diagnosis, and that should include, excluding cancer as a problem here. So you should be doing your imaging, you should be doing the testing that you're supposed to do. But if somebody is concerned about laser causing cancer or worsening a tumor that's undiagnosed, really, we should be able to put that to rest. Hopefully, in the near future, we'll continue to have more and more studies saying that laser can actually be a part of someone's active cancer care. There is excellent evidence saying that you can use laser to help with the side effects of cancer care. And if this helps you be more confident in recommending that, then great. Because when it comes to chemotherapy-induced peripheral neuropathy and dry mouth because of head and neck cancer, chemotherapy and radiation, and so much more, this hopefully makes you feel better about being able to offer that to your patients. If you want to know more about how exactly laser can support patients that are going through active cancer care and help them with some of the side effects, go back to our two-part series that started June 15th, episode 25 and 26 on the Laser Therapy Institute podcast. You can hear more about utilizing laser to help patients get through their care plan successfully. Now, I know this is not just the most clear picture or clear recommendations. This whole thing is still under enormous amounts of investigation. And currently, can we really change our recommendations to stay off of cancerous tumors? I really don't think so. Not really yet. A lot of the evidence points to we can utilize laser to potentially help cancer treatment directly in the future. But I think when it comes to the question of, can you cause cancer by utilizing laser, or can you worsen some kind of undiagnosed cancerous situation? I think the answer there is no. I think you can feel better about using laser to help your patients. Would I still stay away from cancerous tumors? Yes. The only situation where we've used this in clinic has been with patients that are terminal. They're at end of life, and there's really nothing that can be done for them. In a couple of situations, we've had patients that wanted to have laser done for them, knowing that they didn't really have any other choice. And it was able to help those patients out. Now, if you'd like to hear more about that, shoot me an email. We can chat about this. info@lasertherapyinstitute.org. If you'd like to know more, if you'd like protocols for how to help some of these side effects of cancer therapy, like the peripheral neuropathy and oral mucositis, osteonecrosis of the jaw, things like that, get a hold of us. Go to the website, lasertherapyinstitute.org. We can get you protocols. We can help you be confident that you can get good results. And I thank you for joining us this week as we went through this article. I hope you'll join us next week. We've got some good content coming down the pipe. Have a great one.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.